What is the World Health Organization's position regarding African countries acquiring the COVID-19 vaccines? Only a few nations on the continent, including Algeria and Egypt, have managed to purchase vaccines so far. Well, let's get some response now from WHO's Regional New Vaccines Introduction Officer, Fiona Atuhebe, who's joining us now, connected from Kampala in Uganda. Fiona, good morning, and thank you very much for your time. When you look at African countries' efforts to acquire vaccines as the World Health Organization, do you have any concerns currently?
Well, thank you very much, Dan. Do you have any concerns? Yes, we do have concerns because we would have wished to also be among the first people to vaccinate our populations. But no, on the other hand, we've put in place, we anticipated that Africa may be left behind majorly because of our epidemiology of the COVID-19 pandemic. So we put in place a COVAX facility that you may be aware of, that is called by WHO, Gavi and CEPI. So, and in here, our major aim was to ensure that Africa and many other developing countries are not left behind when it comes to the vaccination. So from the COVAX facility, we have ensured that we secure vaccine to cover at least 20% of the African population, given the global supply of the vaccine out there. So no, we are not very worried because the COVAX facility is in place. It's the best thing that could have happened to us as Africa.
And how's the progress with that? How far are we with that?
Lots of strides have been made. We have a number of vaccine candidates in the COVAX facility, only that the COVAX facility will only use vaccine that has been approved for emergency use listing by the World Health Organization. So far, the first vaccine that has received this emergency use approval has been the Pfizer vaccine. And right now, we're working very hard to see how we can also get the initial doses given to the African population to a few countries, because the vaccine doses are still really few by the end of January, by the end of Jan 2021. But we are aware a number of candidates have also been presented for approval to the World Health Organization. And with this, we've made several deals with these manufacturers, AstraZeneca, and a number of other manufacturers are all bringing their documents and dossiers to the table for review. So we hope that by this beginning of the second quarter, we'll have more and more doses coming in for us, for the African population.
Now, I saw a report the other day about AstraZeneca saying that from India, they don't want to export vaccines until they have inoculated a bulk of their population. Will that affect your efforts for the continent?
This should not affect the efforts for our continent because we already signed these deals with these countries. The agreements are there, and the discussions have been ongoing even before the vaccines were out to ensure, because we are now working on something we are calling the global solidarity. That's the space we are working in, to ensure that nobody's left behind. If Africa is left behind, we still have the virus and we still transmit it to the rest of the world. So it is in everybody's interests globally to ensure that each continent is actually covered, because we still have the virus, we still transmit it.
Will you be concerned about these unconfirmed reports and speculation that the vaccines that have been developed so far may not be effective against the new variant of the coronavirus that, for instance, here in South Africa is already present?
It is actually, of course, very worrying for everybody if that happens. But you know that studies have already been done right now to see if this will be affected. Could we see a reduction in the efficacy of the vaccine? Maybe yes, maybe no. Those studies are ongoing to see if the variant will grossly affect the current vaccines that have been produced so far, that we have hopes in, and many others that are in the pipeline. But just like other influenza types that have been there, would this behave the same way? Probably yes, that every 2 years we may need to change the vaccine. But those studies are still underway. But so far, what we know is that this vaccine could still be highly, the efficacy could still be high. Probably it may reduce slightly a bit, but I cannot confirm that for now because the studies are still ongoing.
Okay, Fiona Tumbe, thank you very much. Asante sana. She's coming to us there from Kampala, from the World Health Organization.